By participating in this call today, you are consenting to this recording. Slides from today's call, along with the video recording of only the lecture, will be shared. This is to ensure that we have confidentiality and we're providing a safe space to discuss concerns and ask any questions. Our presentation today is on applying infection control program concepts to applying infection control program concepts to the Champion projects. Today, our presenter is Evelina Majo.
And just to add, Melissa, Evie has an issue connecting, so Karen is going to deliver the didactic.
Okay, thank you, Diane. Not a problem. So we have Karen Kwok here, who is our subject matter expert. So with that, I will now actually turn the call over to Karen. Karen, whenever you're ready, please feel free to start.
Thank you, Melissa, for the introduction. And just briefly, I don't have any disclosures to make. Regarding the objectives of this particular ECHO session, we'll be reviewing and understanding the requirements of infection control programs using assessment, planning, and implementation. And together, we will examine a case study and apply the concepts of infection control. Working through a case study, we will be sharing best practices using the infection control concepts and approaches. With use of the gap analysis and the QI tools, we will have a resource toolkit that we can use in approaching our infection control projects. Next slide, please. In an infection control program, there are the actions in which we develop policies and procedures to control and to minimize the dissemination of infections in healthcare settings with the main purpose of reducing infection rates. Infection control as a formal entity was established in the early 1950s in the United States. By the late 1950s, a small number of hospitals began to recognize that healthcare-associated infections were recognized during this time and that an infection control program needed to be implemented. Thank you. Next slide. Continued regarding infection control programs, there are two tiers of recommended precautions, both standard and transmission-based. Thank you. Next slide. Here are a couple of examples of standard precautions for Tier 1. Next slide. In Tier 2, we also have some examples of transmission-based precautions. However, in this context of the COVID pandemic, we'll be focusing mainly on contact as well as droplet spread precautions. Thank you. Next slide. Specifically, with droplet precautions, we'll be using personal protective equipment in order to mitigate the risk of spread of COVID. Next slide, please. We touch briefly on airborne precautions here regarding the range of infectious diseases that we might encounter in the setting, but again, we'll be focusing mainly on contact and droplet here in the COVID context. Thank you. Next slide. In the toolkit that will be made available with the slide deck following this presentation, we will be sharing some of the signage that you can use in your clinical settings to promote infection control. Next slide, please. Here is the focus of our Champion one-on-one calls, where we are looking at specifically the gap assessment. In that gap assessment, we are starting with the implementation of the program by looking at what are facility practices. From those observations, identifying IPC guidelines and resources. And here are some protocols as to how regulation can be implemented within the IPC program that is in the Champion project proposals. Thank you. Next slide. Specifically with the CDC checklist, this is the guiding document for our infection control programs, and there are the several domains listed here. In the following sessions that we will have, we will drill down specifically into hand hygiene, into the doffing and donning of personal protective equipment. However, we do also invite the champions to provide feedback as to other topics that they would like to drill down on that will be most relevant to their practice and projects. Thank you. Next slide. This particular checklist here in this domain, we're looking at specifically infection control programs and its elements. And with that, you can see that with the policies and procedures that you'll be reviewing, you hopefully will implement regular assessments as to making your standards consistently and in real time relevant and realistic. Thank you. Next slide. Here, you might recognize the activities that you have proposed in your infection control program and how those principles are similarly shared with CDC guides for infection control, both with programs, with staff competency, as well as workplace safety. Thank you. Next slide. Here with the project activities that have been identified in the champion projects that were proposed, we have the AAAHC accreditation section cited here that is relevant to those activities, where specifically you would be conducting regular IPC risk assessments, implementing QI studies, and with the Indian Health Service UIO on-site reviews, you would be also looking to those accrediting bodies for patient satisfaction and for ensuring that IPC, infection control response, recovery, and preparedness are in alignment with your organization's community health education campaigns and communication strategies. Thank you. Next slide. From that gap assessment, those findings should inform your infection control plan, as well as your quality insurance plan. And this cycle, this process of quality improvement is ongoing. Thank you. Next slide. We wanted to provide an example here from Wyoming of performance improvement. What does the process look like? Who are the team members that are involved? What are the regulations, the oversight that will be needed throughout this process in which you are implementing your infection control project? There are many details here and interval steps outlined in this process. But again, the slide deck will be made available to you, and this is but one of the many tools that are used for helping define the performance improvement process. You might find in that same toolkit other tools that might be helpful in helping you plan. And so this is just but an example. Thank you. Next slide. Now, with the PDSA tool in quality improvement, I want you to note here the specific steps to utilizing the tool. This same tool will be used actually in your case study that will be coming up shortly. So in the first step of planning, you're looking at how you might test the same program that you had proposed. How would you go about collecting the data? What data is pertinent to inform those next steps of this PDSA cycle? In doing the next step, you'll be testing on a smaller scale how you would be carrying out the program. But we are absolutely welcome of unexpected observations. What have you learned? How has that informed your process, and how can that be shared as observations, challenges, lessons learned, best practices in this community of learning with other champions? In studying this particular step of the process, you'll be analyzing your results and completing as a team, hopefully gaining insights, not just from your infection control expert, but from administration, from your clinical lead, and ensuring quality improvement is infused in every single step of what you're proposing in your project. Then you next will act on the project that was proposed, adapting, adopting, and possibly abandoning. You might find that for some of the activities that you had collected data on, you analyze that data, that possibly one of the steps or part of the program needs to be better revised to be reflective of your staffing capacity, to be able to be more relevant and realistic to the community you serve, given the services that are offered there. So I want you to take note of those 4 different steps, because we are going to utilize this tool in the case study shortly. Thank you. Next slide. Here in planning, I do want you to think about what is relevant, realistic based on staffing capacity and the operations of your site. When I was bringing up the concept of possibly having unexpected observations in your doing part of the cycle, when you might be considering in the studying part of the cycle that you might need to abandon a particular part of your project or possibly revising it, it's related to what are the short-term as well as the long-term goals of your project. When you're gathering your stakeholder input and from the need that has been expressed, from the assessment that has been conducted, what are some internal, external partnerships that might be necessary to allow you to better execute the project? However, what are the long-term goals in terms of maintaining the governance of the project being able to be implemented successfully and how it can be sustained? Perhaps you might have an advisory board to inform that regulation, making it relevant and realistic every step of the way. And as you're developing this program, is its purpose still fulfilling the target population, the communities that you have served? And you might develop over time the positions as they evolve and grow in terms of serving the community, the services that are offered with the accreditation that many of the champions are seeking now. And in that, we hope a finished product would include the policies and procedures in your infection control. Thank you. Next slide. So here are a list of curated resources from CDC, OSHA, the national academies, and these are tools at your fingertips that can be perused later to be cited as to informing your project, informing your policies and procedures, which are the actions in your infection control. And they will be available in the toolkit along with the slide deck here. Thank you. Next slide. So it was a whirlwind of a lot of information. And again, this will be available in the slide deck I want to first summarize briefly what was covered here before we get into the case study where you'll be actually applying the PDSA tool. The information condensed here solidifies and builds upon infection control concepts, including precautions to prevent the spread of specific diseases, particularly interventions to control COVID risk through contact and droplet spread. In this echo, as well as the champion one-on-one calls, we introduced the CDC checklist tool to perform the gap assessment. And based on this assessment, these findings inform the IPC and the QI plan and activities. We introduced one commonly used QI tool, PDSA, that will be utilized shortly in the case study. But before doing so, I want to welcome any questions that you might have. And I also see that Evie was able to jump on. And so I want to welcome any thoughts that she might have as well, or from the rest of the team members.
Hi, Karen. Thank you for presenting that. I have a question. We actually looked at both the WHO and the CDC assessment tools, and I noticed that the WHO one has like the scoring ability, and it's able to like stratify you in terms of where you fall. How does the CDC one work in terms of naming gap or scoring you, or how does that part work on the CDC tool?
Thank you for that question. So with the CDC checklist, we found that some of the champions on our one-on-one calls felt that it was easier to read and was outlined specifically in chunks that were relevant to their practice and to the services that were offered. And so the WHO is a little bit more dense, and some of the domains that they might have might not necessarily be relevant to the champion services that are offered per facility. For example, we have one of the champions who is a referral center mainly. So when there are questions that are talking about actually the device use or reprocessing, that isn't necessarily relevant. And so when you score according to categories that are not relevant to you, artificially it looks like, oh, I don't have everything, but that's not the point. Here, as champions of infection control and representatives of meeting those unmet needs for our communities in Indian country, it's that you pick the tool that's most relevant to you. You look specifically at the domains that are relevant to your scope of practice at your facility, and then therefore the staffing capacity that's needed. And then you assess according to that domain, score yourself there, and then on the one-on-one champion calls and the touchbacks we'll be having monthly, we'll be reviewing together how you might use a tool such as the PDSA to help you plan out what are the activities that will be part of your project, and that will also inform your performance improvement and QI plan, and how this possibly can also lead to your goal for accreditation. I hope that's helpful.
Yeah, so it sounds like there's not really a score or a tally or tabulation of the CDC one. It sounds like if there are gaps and things that are missing, then through our one-on-ones, we will like interpret gap and then determine or define what is to be addressed. Okay.
Exactly. This is meant to be useful to you, to be step by step in a community of practice, learning together how we can better serve the needs and raise capacity, elevate what you're already doing, and giving it, as Nancy said, like a facelift. Any other questions? I know there's several other champions on the call. I'm hoping that if you don't ask a question now, I might just have to call on each of you during our case study.
So Evie has joined, Karen, and I don't know if Evie wanted to add anything. I do know that from some of the survey responses we had from the last didactic, some folks wanted to recap some more of the infection control requirements or policies and procedures. So if they have questions about that, we can take that. If Evie wanted to make a comment, we can do that. If not, we can move to the case discussion. So I'll hand over to Evie. I know Evie's system was frozen. Evie, are you able to hear us? If not, and there are no questions, Karen, we can hand over to Melissa to continue.
Actually, I think Mr. Delgado had come off mute. I think he might have a question.
Okay,
Yes,
go ahead.
I did. Sorry. With now, Karen, when you're responding to Felicia, you made a comment of us doing the PDSA assessments and evaluating them. Are we evaluating the data from those assessments with you, or with who do we evaluate that as internally as an organization? Are we doing it in a CUI? Who do we speak to about that data?
So good question. Thank you for clarifying, Johnny. With the PDSA, we are introducing that as a tool here, but you actually have a range of tools that are going to be provided in the toolkit. It's meant to be useful in framing how you go about planning your IPC program activities. And we will look at the gap assessment that you had completed on the one-on-one champion calls. You might choose to do the PDSA QI tool to help map out a particular objective like staff competency assessments. And you'll gather data on how staff competency is now related to the Droplet risk mitigation for COVID, for example, and then look at how the information will be gathered and analyzed through which team members. And then through that QI tool process, you'll then study how you will have specific activities. Would it be a competency checklist that you're saying, okay, we've observed the staff now in this scenario, and they did well with doing their hand hygiene, with donning and doffing their gowns, such that then the contact, the droplet risk of spread is less. And so it's but a tool that we're going to practice here, but that you can also consider using in your gap analysis to inform the planning of your activities. And in the champion calls, particularly the monthly 15-minute check-ins, you can tell us, how are you doing with the tools? Is it useful to you? Is it helping you better frame what's realistic and relevant in the activities that you're doing based on your staffing capacity, as well as the activities proposed in your project? I hope that helped clarify.
Yeah, so what I'm getting is that it's more so just a tool that we can use to conduct the surveys for the gap analysis that we will then report on in our one-on-one champion calls.
Exactly.
So, okay, gotcha. Thank you.
Yeah, thank you. And if any of my team members want to chime in too, as well, feel free. And we still welcome any questions from our audience here. And remember, you also have that opportunity to bring up those questions as they arise with the case study too.
Well, thank you, Karen, and thank you everyone for all of your questions. We do appreciate the discussion. But for now, we will actually move over into the case presentation. So again, I just want to thank you all for your questions. And on behalf of Evie, she just wanted me to apologize on behalf of her computer system for not being able to sign out for us today. But thank you, Karen, for stepping in. So going into our case presentation, we would like to note that we will now end our recording. The rest of our meeting is not going to be recorded. So we will go into